My name's Angela Hywood, and I'm thrilled to present to you today from October Masterclass, Male and Female Botanicals for Infertility. And the latest developments in male and female reproductive healthcare. I spend the vast majority of my clinical practice time supporting couples in order to overcome fertility challenges and help them have happy, healthy pregnancies and happy, healthy children. So this is an area that's particularly close to my heart because it is the mainstay of my clinical practice. So we're going to divide it into two sections today, obviously men's fertility and women's fertility. And to be honest, it was such a challenge for me to distill all this information down into just 75 minutes. I usually teach, full 2-day weekend masterclasses on this type of topic. So I'm going to give you the real highlights, the real clinical juice, so you can take this straight back to practice on Monday. So when it comes to male fertility, I often laugh and say, gosh, is, the immune problems we're facing in this day and age the real pandemic? Or is the silent pandemic infertility? Infertility affects 15% of couples around the world. And believe it or not, male infertility can account for up to 30% of problems when it comes to couples not conceiving, and can contribute to 50% of overall cases. So men do need to be checked. That's the very first thing. If you have a female in front of you who says she's struggling to try and conceive, the very first thing you've got to do is check her partner's sperm health and reproductive well-being. Now, 12% of men in the United States of average age between teenagers and mid-40s are subfertile. Even our very young, pubescent teens are suffering with sperm health issues and reproductive challenges. And this is because environmental stress and toxicity and inflammation and nutritional deficiency, just to name a few problems. Nearly 50% of the men dealing with infertility have a low sperm count, and this is considered one of the most overall overarching problems associated with reproductive failure. And we'll dig deeper as to why that is the case. Now, the alarming international statistic is that between 1973 and 2011, when this metadata study was done, there has been an overall 59.3% drop in average sperm count in men. Isn't that alarming? So we're seeing, again, one of the most, crisis-related numbers in male reproductive problems in essentially one generation. In the 1980s, a normal sperm morphology, and morphology is like a swimsuit, the normality of the head, the body, and the tail of the sperm. So in the 80s, it was expected a normal morphology would be as high as about 80%. Now, fertility specialists are happy if the morphology is anything over 5%. Isn't that alarming? So they say, 5% normal sperm or more, that's perfectly acceptable. Now, we've got to remember that's fertility doctors who have fertility clinics and are doing IVF. Their scientists can hand select a sperm that has a normal morphology and select that for the IVF fertilization process. In 1992, a normal sperm morphology was expected to only be over 30%. And nowadays, sitting here in 2022, a normal morphology is said to be anything over 4%. So it's alarming how we've dropped our standards and we've dropped them further, and yet we've dropped them further again. And this is because they always take, an average of the population of what they're seeing to consider as normal. So as I said, in 2022, 4% normal morphology is the benchmark, which means it's acceptable that 96% of the sperm are unhealthy and morphologically abnormal. So I'm going to talk through some fast facts about sperm. Sperm life cycle is approximately 72 days. So what happens to that reproductive cell, that sperm during the 72 days, is what's going to dramatically impact its fertility outcome. Sperm is 30 times smaller than a woman's egg, being the smallest cell in a man's body. The smaller the cell, the more vulnerable to toxicity, inflammation, nutritional deficiency, biological stress that cell will be. So what I'm saying here is sperm are incredibly vulnerable little cells. In my clinical experience, in my 25 years of clinical practice and 20 of that specialising in fertility, most male fertility problems can be easily overcome with changes in diet, lifestyle, and evidence-based naturopathic medicines, so herbal medicine and clinical nutrition. And what we can do is turn that sperm health around and dramatically improve it over 3 to 4 months, allowing a full spermatogenesis cycle for that sperm to be matured and influenced in an optimal environment versus a toxic environment. So the sperm DNA is, after all, 50% of the DNA of your future child. So what men bring to the party is incredibly important. Now, sperm also happen to be easy to get out of the human body and easy to be able to test. So it's not terribly expensive, and it's actually easy to get a sperm sample to be able to test. So we've got absolute parameters on, a before and after with treatment strategies and treatment protocols. So spermatogenesis cycle consists of 6 stages, and there's approximately then 5 cycles required to produce 1 mature sperm. So once again, this happens over the course of around about 3 months, and this is why 3 months of diet, lifestyle, and protocol intervention can make a dramatic impact in improving men's sperm health and then the couple's overall reproductive status. Okay, so we always must consider illness, inflammation, toxicity, trauma to the testes, so contact sports, nutritional status, inflammation, and any other factors that can affect the man's overall health, but particularly can affect the sperm health. So we need to do a deep dive into, his health, pharmaceutical medications, inflammatory status, nutritional deficiency. Sport is also really important. Does a man have a sauna often? That raises testicular temperature. That will cause oxidative stress and can damage the sperm quality and DNA. Likewise, men who cycle a lot for sport. Cycling pushes the testes up closer to the body, raises testicular temperature, and can risk having an adverse effect on male fertility. So we need to do a deep dive and really ask the right questions to assess what may be impacting the sperm health on that negative spectrum. Okay, sperm spend between 2 to 10 days passing through the epididymis, during which time they mature and then become capable of swimming all the way from the top of the cervix up to the top of the fallopian tube, and then being able to actually result in penetration of the oocyte lipid membrane and then resulting conception of that egg. So I won't go through this, but if you're reading sperm analysis papers or reports, here are some terminologies that are common in the male reproductive world. I've given that to you just as a point of reference. Now, what defines male infertility? Well, one of the diagnostic summaries is if a couple have been unable to conceive a child after 12 months of trying to conceive with regular unprotected intercourse at least twice a week with the same female partner in the absence of any female reproductive causes or problems. So this is a big point. One of the first things I'll ask couples is, how often are you having intercourse and how long have you been trying to conceive? Now, a lot of couples, due to stress and busy lifestyle, or actually, working, different hours, shift hours, or even working in different, states. Here in Western Australia, where I live, we're a big mining community. So men are often away 2 weeks of the month, which dramatically reduces couples' chances of conception, of course. So we need to really say it's got to be twice weekly, trying to conceive for 12 months, in the absence of female issues, that we would start to think, oh, okay, what's going on with sperm health? So as I said, when we're looking at sperm abnormalities, we're looking at sperm count, sperm morphology, so the shape of the head, body, and tail of the sperm, motility, and other aspects such as DNA fragmentation. So sperm analysis can get so specific now that scientists can actually culture the DNA to actually see whether the DNA is fragmented or broken, which of course would cause higher risks of infertility and miscarriage, or whether it's healthy and normal. So some of the common drivers of male infertility, we have primary hypogonadism, which is androgen insensitivity, can be congenital or a developmental testicular disorder. It can be associated with certain pharmaceutical medications as well, such as anti-androgenic medications, Tagamet, spirulactone, to name a few. So checking out any pharmaceuticals that they're on, why they're on them, and looking into them in more depth is important. Now, there's genetic causes of male infertility, such as Y chromosome defect. So karyotyping is one testing that will be done fairly routinely by any medical fertility specialist as investigation. Then there's alterations in sperm transport, which can account for up to 20% of male fertility problems, which can be, absence of vas deferens or obstruction of the vas deferens, prostate-related complication, post-infection obstructions, erectile dysfunction, for example. And of course, vasectomy is, of course, where they cut the vas deferens so sperm cannot transport. A lot of men might want a second family, or couples might want more children after they've had a vasectomy for a number of reasons. So vasectomy reversals can be tried, but they're often unsuccessful if the vasectomy was done over 10 years ago. And that's because of the buildup of scar tissue, and then the brain and testes reducing supply demand because the sperm's not being released from the body. Secondary hypogonadism can account for a very small amount of male fertility problems, 1 to 2%. And this is where there is an excess androgenic state that can be from a tumor. More likely these days, some men are taking testosterone if their testosterone is low, which, believe it or not, can actually shrink the testes and drive a secondary hypogonadism and have a very adverse effect on male sperm health. There's congenital reasons, there's estrogen dominant reasons as well, once again, predominantly tumor driven, but our environment is full of xenoestrogens and can adversely affect male fertility, just like it can female fertility. Then, of course, medications can interfere here as well. Genetic disorders, trauma to the testes can be affected here as well. So it accounts only for a very small percentage of male infertility. Then there is developmental or physiological reasons that can drive male fertility problems, such as undescended testes. Varicocele I see quite commonly. So when I'm seeing on a sperm analysis low sperm count, morphology, and motility, one of the first things that I will do is refer men off for a testicular ultrasound to rule out a varicocele being a part of the problem. So varicoceles, of course, are like varicose veins in the testes. This raises testicular temperature and therefore damages the sperm. So minor surgical procedure can correct a varicocele, and then the next spermatogenesis cycle in 3 to 4 months later, generally you'll see a lot better sperm quality. So don't forget that. Often men don't even know that they have the varicocele there. Testicular torsion, testicular trauma, or testicular inflammation, of course, can cause issues there as well. But the most common one I will see would be varicoceles from this perspective. Then if men have any, chronic infection, inflammation, sperm antibodies or autoimmune diseases, this can impact from an immunological perspective sperm health as well. So we can actually check sperm directly for infection or leukocytes. You can check it directly for sperm antibodies. So sometimes the testes produce antibodies and the sperm then actually the sperm heads stick together due to the antibody load, which will then result in an elevated agglutination or viscosity of the sperm, and then an inability to then drive conception. So that needs to be, checked out as well. And then the big one that can account for up to 50% of male infertility is unknown causes. Now, the medical fraternity and journals will note unexplained or unknown reasons, but this is where we come into natural medicine. So our understanding of environmental toxicity, oxidative stress, radiation exposure. So my question to you is, where do men usually put their mobile phone or their cell phone? It goes into the pocket right near the testes. Mobile and cell phones work from radiation. So essentially that's driving irradiation of the testicular area and potential damage of the DNA in the sperm. So excessive heat to the testes, like, regular hot bathing or regular saunas, can cause problems. The big one is nutritional status. So, drinking, alcohol, not eating well, not being, conscious of taking good antioxidants from a supplemental perspective. Then we've got heavy metals, environmental toxicities, pesticide and herbicide exposures, systemic disorders, so any degree of ill health, but particularly metabolic and cardiometabolic complications really cause an enormous damage to sperm because of the drivers of inflammation. Then we have genitourinary tract infections, hormonal imbalances, smoking, use of recreational drugs, age-related decline. It is an urban myth, a modern fallacy, that men can conceive and have a baby at any age. Men go through andropause, like women go through menopause, and it can become increasingly difficult for men to father a child or conceive as they age due to decline in sperm health and DNA integrity. So as I said, obesity, cardiometabolic disease, metabolic syndrome all dramatically drive inflammatory mediators, which really damage sperm significantly. So that's just a bit of a take on some of the other areas we holistic practitioners or natural medicine advocates are really going to be honing in on to look at sperm health and well-being. So abnormal sperm, that's normal according to the medical fraternity. And as I'd already mentioned, it's perfectly acceptable in 2022 that 96% of a sperm sample are abnormal. So we're really reducing our chances of conceiving naturally when we only have 4% of sperm with a normal morphology. So morphology is the normality, the normal shape of a sperm. As you can see in this image here, a normal sperm has one head, one midpiece or a body, and one tail. Then we have abnormal morphological features, which is all the other images I've provided for you here. So giant sperm, microsperm, double-headed, double-bodied, long-tailed, rough head, abnormal neck, and potentially tail defect as well. So this what would account for that 96% abnormality. So I've already mentioned we are in a total pandemic of a fertility crisis internationally. Fertility clinics internationally are one of the most profitable medical specializations, as you can imagine, because there's no greater human desire than to be able to have a family, if that's what couples choose. So couples will spend whatever it takes to overcome their fertility problems and have a baby. And this is why IVF clinics are, medically very profitable and sometimes necessary, but you want to make sure that if couples are going through any assisted reproductive technologies, that they're going in with the best chances. And that means doing preconception healthcare with you, a good old-fashioned detox, and then 3 to 4 months of good nutrition in the lead up to going through that process to optimize their chances. IVF doctors are the first ones to say they're actually only as good as the quality of eggs and the quality of sperm that they have to work on that very day that they assist with that conception. So in 1992, as I'd mentioned, a study found a global 50% decline in men's sperm count over the previous 60 years. And in 2017, again, multiple metadata suggests that there was a further 60% decline in men's sperm health worldwide. That's absolutely showing us that we have a crisis in reproductive status of the human species. Now, miscarriage is dramatically affected by male sperm quality and the DNA health coming through that sperm. Now, I'm very passionate about this particular area. I know that couples who experience miscarriage are heartbroken time and time again. It's the loss of hope, the loss of that dream of that little baby that they so desperately want. So I'm so fascinated in this area that when I did my Masters of Reproductive Medicine, I actually did my thesis on recurrent miscarriage, which was then subsequently published in an Australian naturopathic textbook. So sperm DNA fragmentation or breakage in the DNA of the man's sperm is a biomarker for early pregnancy loss that is absolutely determined now by a vast number of studies. So it's reported that about 10 to 15% of couples will experience early pregnancy loss. They say as many as 1/3 of all pregnancies will end in miscarriage. Now, as I said, it's heartbreaking. It's, common. Often it's not even investigated until a couple have had 3 miscarriages, and then their, specialists might start to look at investigating it. Whereas we can start to investigate it much sooner by suggesting that a man has a sperm analysis with a DNA fragmentation test done through a good fertility clinic. If you see high DNA fragmentation, we need to treat this with botanicals and antioxidants for 3 to 4 months, repeat the test, and when the DNA fragmentation is significantly lowered or less than 5%, that's when I give the green light to start to try and conceive again. So given that, of course, the man's sperm contributes to 50% of their child's genetic health, it makes absolute sense that if there's DNA breakage or fragmentation, that's only going to end in either ill health of the child or a fatal miscarriage for that pregnancy. So it's so important that we do this particular part of a sperm analysis to risk assess and to try and prevent the heartbreak of miscarriage. Okay, and here's one of the really good clinical papers that I can refer you to for further reading, driving and really showing us that sperm DNA fragmentation is now directly linked as a biomarker for early pregnancy loss. So when the DNA fragmentation exceeds 25%, it's almost certain that that pregnancy will result in miscarriage. So the lower the DNA fragmentation, the better. I'm always aiming for under 5% DNA fragmentation in a sperm analysis report. Sometimes you'll very specifically have to ask for this. This is not done as a routine part of a sperm analysis. And generally, this can only be done through an assisted reproductive technology laboratory. Okay, so what causes DNA fragmentation in sperm? Varicocele can drive an increased testicular temperature, so cyclists or men who sauna or have hot baths very regularly, smoking, stress that drives inflammation, alcohol exposure is a big one. I say with absolutely no hesitation, men who are trying to conceive and help their partners be pregnant need to stop drinking alcohol. No amount of alcohol is a safe amount of alcohol when you're trying to conceive for men or women. A poor diet with an increased BMI, so cardiometabolic complications, really drive DNA fragmentation. Now, studies also show infrequent ejaculation also drives DNA fragmentation when the sperm is sitting in the testes. So clinical research shows, once again, men need to be ejaculating every 2 to 3 days to lower DNA fragmentation. So the process of, aging, pollution, toxicity, radiation, recreational drugs, some pharmaceutical medications, high caffeine intake, all of these collectively will significantly damaged sperm. And as I said, elevated DNA fragmentation is a confirmed biomarker of miscarriage risk for the partners. So there's so much that we can do about it. We need to take a whole human health perspective and, get men exercising, doing a detox, resolving any obesity or insulin resistant, working with reducing pesticides and herbicides and being aware of radiation, cleaning up diet and lifestyle. So it is really the ultimate health overhaul in order to improve reproductive health and fertility. Okay, so again, other factors that can affect DNA quality: age. So as men age, the DNA becomes more fragmented and higher risk of miscarriage. So that's due to oxidative stress and just a decline in general health status as men tend to age. BMI is a really big part of this as well. So men need to aim to maintain a healthy body weight, get regular exercise, overcome obesity, in order to lower the DNA fragmentation and reduce risks of reproductive complications. So again, a great place to start for all couples is a good month of a nice, thorough and a very holistic detox strategy approach. Men also need to, as I've mentioned, in no uncertain terms, give up the alcohol. Beer and red wine or whatever they like to drink. We need to have an alcohol-free at least 3 to 4 months in the preconception phase to optimize sperm health and improve DNA quality. And then ejaculation frequency is one strategy the reproductive doctors use to try and lower the DNA fragmentation, is to ensure that men are ejaculating every 2 to 3 days, and research shows that that can help lower DNA fragmentation. And the theory around that is simply because the longer the sperm stays in the body, the more oxidative stress and inflammation it's exposed to, which then reduces the DNA quality. So if we get the sperm out of the body more frequently, the turnover and spermatogenesis cycle is improved, but also the sperm's just not being exposed to the levels of inflammation and environmental toxicities in the body. So, of course, everybody knows that caffeine and smoking are toxicities and toxins that can cause problems with reproductive health. So the 3 to 4 month preconceptual phase, men need to be reducing caffeine content to below 300 milligrams a day or getting rid of it altogether. And of course, stopping smoking. Smoking and nicotine have been linked to elevated DNA fragmentation, and for not surprising reasons, they drive oxidative stress and DNA damage in the body. Okay, recreational drugs we've talked about, like marijuana, opiates, methamphetamines, anabolic steroids, etc., have all been shown to cause problems in reproductive health in men and in women. One of the sort of drug families that really concerns me with reproductive health is the ADHD medications a lot of people are relying on. That's dexamphetamine, essentially, and that can really reduce couples' chances of conceiving. So if they are adult ADHD and relying on those medications, we need to be transitioning them to some natural medicine support to help their cognitive function and help them cope. And this in turn will help also improve their fertility. And then we need a lot of education about, environmental toxins, pollutants, herbicides, pesticides, because these have all been directly shown to increase DNA damage in sperm and also have a dramatic negative impact on women's egg health as well. So we need to really educate them about environment and lifestyle and how that can really impact and if they learn to avoid, positively improve their fertility. Okay, diet matters for men. So, I go so far as to say probably even more than diet matters for women. Sperm are such tiny, vulnerable cells that they need to be really protected and nourished. So, clinical studies have shown that men who are overweight and have a high BMI have slower sperm and lower concentration of sperm. Men who drink alcohol regularly have lower sperm motility and lower concentration. Smokers had very poor sperm motility. Alcohol and coffee were shown to reduce chances of fertilization. And men who ate excessive red meat, their partners had lowered implantation of a conceived embryo and lower pregnancy rates. So red meat can be an oxidative stressor. Men who were on a weight loss diet had lower implementation and pregnancy rates. So essentially, the weight loss needs to happen prior to then trying to conceive, because as people are burning fat and losing weight, which is a good thing, you're releasing a lot of inflammatory mediators and toxins that have been locked up in those adipose, the fatty adipose tissue. So initially, when people are burning fat and losing weight, it can increase the toxic load in the body. So the weight loss needs to happen prior to then starting to try and conceive again. So positive findings: men who ate more whole grains versus refined carbohydrates in their diet had a higher sperm concentration and motility. So whole grains versus refined carbohydrates still is providing you with fiber and better microbiome support and better B vitamins and better whole food nutrition. Consumption of fresh fruit gave sperm a boost in speed and agility. So, having more whole foods, fruits and vegetables for the polyphenol content and all your beautiful natural vitamin content really improves reproductive health. And men who consume more healthy meals a day had overall better success rates with fertility and conception. So it's not rocket science. We just need to get out the refined foods, get coffee and alcohol out, lose weight and get a healthy BMI prior to starting to try and conceive, and eat a Western price-based whole food traditional diet. So when it comes to interpreting a sperm analysis, we need to look closely at each variability. We need to never diagnose on one sample. So if it's not looking good, then repeat the sample a few months later to cross-check. The reports usually are pretty good and will have lots of additional comments. The people that specialise in andrology and male reproductive health, they're very passionate about what they do. And they will always give you additional comments and feedback about that sperm analysis. Ask patients questions relating their collection. It's really important that you get a full ejaculate sample versus just part of an ejaculate sample to accurately look at sperm count, for example. There's different laboratories who use different guidelines. The most accurate guideline will be the WHO 6th edition of the Manual for Examining and Processing Human Sperm. So there's a visual diagram of what this report looks like, and that's the most up-to-date guidelines that reproductive labs should be using for interpretation of sperm analysis. So remember, there's different labs, different quality of labs, and different quality of sperm analysis. And this is why you need to be using an assisted reproductive technology lab who have specialist andrologists that are specialists in looking at sperm samples and interpreting them properly. Okay, so now let's have a look at some supportive treatments, of which we have an absolute abundance. So a single sperm is comprised of an enormous amount of nutritional factors. We need a high density of available nutrition in the body to help sperm mature well and be healthy and swim fast and have healthy DNA. So sperm require great amount of protein and amino acids, essential fatty acids, selenium, CoQ10, antioxidants, B vitamins, vitamin D, calcium, and sufficient hydration. So this is what a man's body requires to be abundant in order to give the sperm half a chance to be healthy and fertile. Okay, now I'm going to give you some a fantastic distillation of my 25 years of practice when it comes to looking at sperm analysis and knowing what to do about it. So if you see an abnormality of higher agglutination, so increased viscosity and the sperm sticking together, this can often be a prostate-related issue or a hydration-related issue. So the core herbs I would use in this element would be saw, palmetto, and tribulus. If we need to boost a man's sperm count, so literally get physically more sperm happening, as we know there's an actual crisis in sperm count internationally. It's dropped dramatically in a generation. Okay, herbs that have evidence basis to improve sperm count are Korean ginseng, tribulus, and saw palmetto. Herbs that help increase a poor motility, so increase sperm and help them swim faster, will be Korean ginseng, tribulus, astragalus, and tonka ali, a new amazing male herb we have available to us. If there's sperm antibodies, so autoimmune issues or immunological complications, then we need to hit it from an immune-mediated perspective. So echinacea, hemidesmus, Romania, and once again, there's some research around tonka ali as being absolutely brilliant from that immune fertility perspective. Okay, if there's endocrine factors, so low testosterone, low androgens driving poor sperm health, then we have Korean ginseng, Damiana, ashwagandha, and tonka ali. If there's a poor sperm morphology, we need to really go in with antioxidant therapy from a nutritional perspective. But from a herbal perspective, we're looking at saw palmetto, ginkgo biloba, turmeric. Really highlight turmeric. It's such a powerful antioxidant. And once again, tonka ali. When it comes to protecting the integrity of the DNA and reducing risks of DNA fragmentation, we really want to focus on herbs that have this NRF2 support, okay, really protecting and repairing the integrity of the DNA. So in addition to ashwagandha, we would be using turmeric, milk thistle, rosemary, polygonum or Japanese knotweed, green tea, and grapeseed extract, our really high potency antioxidant botanical family. So our core phytotherapy perspective on improving DNA health and reducing risks of DNA fragmentation. Our core herbs are going to be our high potency turmeric, rosemary, green tea polyphenols, grapeseed, ginkgo, resveratrol, and cruciferous vegetables. So we really need to detoxify and support the NRF2 pathway. Then we have Korean ginseng, ginkgo, rhodiola, hawthorn, and again, NRF2 supporting herbs to boost mitochondrial function. Mitochondria in sperm are really responsible for how quickly they can swim, so improving that sperm motility factor. So mitochondrial well-being and all of our mitochondrial strategies are critically important. Interestingly, when conception happens, all the mitochondria from the male sperm actually shed off, and the baby that results in that conception inherits its mother's mitochondria or mitochondrial well-being. But mitochondrial health in sperm is critical for good motility. Okay, we need to provide all of our antioxidants from a nutritional perspective to improve DNA health and sperm health. But particularly, there's great research around alpha lipoic acid, vitamin C and E, lycopene coming from tomato concentrates, selenium, coenzyme Q10, and an abundance of zinc. We also need vitamins B9 and B12, vitamin D, and arginine as an amino acid. It's got a lot of research around supporting sperm health, but particularly DNA integrity. So let's now look at the core botanicals for men's fertility. So ashwagandha, or Withania somnifera, it's traditionally been used in Ayurvedic medicine as a core men's adaptogen, and it's been used as a treatment for male infertility for more than 3,000 years in the Ayurvedic medicine system. Ashwagandha contains withanolides as its core active constituent, and it's been widely used for erectile dysfunction, low sperm count, and many other male health problems. Ashwagandha, we see, lowers cortisol, improves testosterone, improves endurance, and is one of the core botanicals that I focus in for men's reproductive health and well-being. One of the biggest benefits of ashwagandha is its ability to increase DHEA. And DHEA is a precursor to testosterone. Therefore, we see better androgens when men are taking withania or ashwagandha, which results in improved male fertility. Okay, another fantastic herb and a real classic from Chinese medicine system is Panax ginseng or Korean ginseng. So studies have showed the ginsenosides to have a major action in improving serum testosterone concentration, enhancing nitric oxide release, so better erectile strength and capability in men. So it's traditionally been used as a general tonic for men in the Chinese medicine system for thousands of years, and particularly those with fertility issues. So a meta-analysis suggests that it plays a very important role in treatments for erectile dysfunction and therefore in male fertility. So it's a really amazing herb. Then we have the new beautiful herb, Tonka Ale, which is a new addition to the herbs that we have available to you in the United States. And I'm really excited about this new herb for men's reproductive health. Studies show that Tonka Ale increases sperm volume and motility by an average of 18% and 44% respectively. So it's a wonderful general reproductive tonic when taken over 3 months when trying to conceive. Other studies clearly show that Tonka Ale improves sperm concentration, it helps to normalize sperm morphology and improve sperm motility. So it's a wonderful herb for all 3 of those major factors in a sperm analysis. So studies also show there was higher rates of spontaneous pregnancy when men have been taking Tonka Ale, and sperm parameters in the male partners had improved dramatically. So we have really the good fortune of having this incredible and valuable herb now available to us. So here's a snapshot summary of the 5 major herbs for men's fertility: Tonka Ale, tribulus, ashwagandha, Korean ginseng, and astragalus, and each part that they can play in male reproductive health. So this is a wonderful little cheat sheet for your clinical practice to help you prescribe for and around sperm analysis results or general support for male fertility. So the core synergistic partners, Tonka Ale and tribulus, work beautifully together to support androgen health, promote male fertility, and improve sperm and semen parameters. Korean ginseng, ashwagandha, and rhodiola are wonderful adaptogens and tonics, all helping to support better endocrine function in men and therefore better sperm health. We need to really provide a lot of antioxidant botanical support for optimizing DNA health and reducing miscarriage risk in the partners of the men. So all of our DNA protecting herbs, grapeseed, green tea, turmeric, bilberry, ginkgo, schisandra, rosemary, and milk thistle. So all the NRF2 upregulating herbs. And then to enhance and improve immunity, the sperm immune axis, the male fertility immune axis, and help the sperm with enough energy to move, astragalus is absolutely brilliant. And echinacea is a fantastic broad sweep immunological support if there's any autoantibodies in the sperm or if there's any other immune-mediated issues. And then, of course, we have turmeric and ginkgo, NRF2 upregulators. They improve microcirculation and provide a very powerful broad spectrum anti-inflammatory support for the body. So that comes to the end of our male fertility section. So I hope there were some fantastic clinical pearls for you within there. But botanical medicine is absolutely critical to the success of my clinical practice to improve sperm health within 3 to 6 months for couples and help them on the way to a natural conception. Let's now take a look at supporting female fertility. Again, a really big area of my clinical practice. So good female fertility starts with good preconception healthcare. So it starts with the health of the egg, which is the presence of all the factors required for optimal female fertility and creation of a healthy baby, and the absence of all the known detrimental factors that can cause problems with egg health and problems with fertility and risks to a baby in utero. Then we want to simply aim for optimal general health and good reproductive health of both partners, because they're creating another human being, after all. And we want to give this baby the best chance in life with beautiful, healthy DNA coming from the mother's eggs, beautiful, healthy, strong DNA coming from their father's sperm, and then an optimal in utero environment to grow and develop. So, how long is the window of preconception healthcare? So, preconception healthcare is a critical 4-month period of time. So, a woman's egg, or the oogenesis cycle, is 120 days. Now, we can't shortcut that and make that faster. That is human biology. We can't change that. And it's the environment in which that egg is maturing and developing in the ovary that will then influence its health, its viability, its DNA quality, etc. Now, there's no way we can get eggs out of the female body and test them for DNA quality. That's virtually impossible, and they just don't do it. So men's sperm's easy to get out of the body. So this is why we can quickly and easily assess DNA fragmentation indexing, but we can't with women. So the instant the egg and sperm fertilize, we irreversibly set the genetic code that forms that future development of that baby. This is why the genetic health of mum and dad prior to conception is so incredibly important for the health of that child for the rest of that child's life. So health of the egg and sperm reflects the health or potentially the toxicity of the environment in which the egg and sperm grow. So here is a wonderful visual of follicular genesis or oocyte development, showing that from phase 1 recruitment right through to a dominant follicle being chosen and that dominant follicle being ovulated is a 120-day process. And this really determines why that critical window for preconception healthcare and optimizing fertility needs to be 121 days of treatment at least. So it's a critical 4-month window. And explaining this to patients is really important. Patients will often say to me, but I want to do IVF next month. So can you help me with egg quality? And I say, well, I wish I can, but in order to actually truly improve egg quality, you need to give me 4 months to improve every step of the follicular genesis. So there's a lot of research around this. So 100 to 120 days is really critical. We need to mitigate toxin exposure, improve nutritional density in the body, overcome nutritional deficiencies, improve microcirculation, reduce inflammation, correct hormones. So there is an enormous amount of work that needs to be done during this preconception phase. Now, age will impact women's ability to conceive. As you can see, once again, this is just human biology. Our egg count declines enormously as we age. And generally, by the time a woman reaches her 40s, the maximum sort of chance based on all the metadata and statistics of conceiving each cycle goes down to about 5%. So by doing preconception healthcare, we're doing everything we can possibly do to optimize egg vitality, DNA integrity, optimize hormones to try and then improve that statistic and chance of conceiving naturally. Okay, so fertility gradually decreases, as we age, and accelerates dramatically about from the age of 40. So chances of conceiving cycle by cycle over 40 is around about 5%. By 40 to 41, about 50% of women have completely lost their capacity for reproduction. And we can mark this by a hormone, AMH. which looks at egg reserve, which I'll talk to you about a bit more in a moment. So reproductive aging essentially is ovarian aging. And approximately 20% of women worldwide these days wait till over the age of 35 to begin their families. Now, that can be for social reasons, for educational reasons, for all sorts of reasons, but it's not always around just career advancement. I talk to a lot of young women who are just finding it harder to find their life partner in order to then be able to find their families. So there's a lot of different reasons why there's this advanced age now before people are starting to try and conceive. So the effects of aging, we have, poor ovarian response to hormones. We have, of course, elevated DNA fragmentation probably coming through the eggs as well. Genetic triggers for premature ovarian failure. These can all lead to increased miscarriage risk and increase of genetic abnormalities and chromosomal abnormalities. There's also the impacts of the more common autoimmune diseases happening these days, thyroid complications, obesity, cardiometabolic disease that tends to be more popular and more common in our society, which dramatically improves our reproductive health and well-being. So assessing ovarian reserve, how do we do that? So it's a blood test called FSH, which is a day or 2 or 3 cycle day collection. So day 1 being the first day of a period. This is a marker just to really give you a take on how estrogen levels are going, rather than tell us anything about egg reserve. So FSH needs to really sit below 10 to show you have good estrogen, which will drive a good follicular phase, which will drive a better quality ovulation. The big one that the reproductive doctors do is an AMH test, or anti-Mullerian hormone test, which again needs to be done early in the follicular phase. Now, this is a protein hormone secreted by the granulosa cells of immature or preantral follicles in the ovary, which gives you some indication of overall ovarian reserve of eggs. It's often called the egg counter test. So AMH declines with age because our ovarian reserve declines with age as well. So this is a generalized test. Now, this one was developed for really people going through IVF. As the AMH reduces, IVF doctors know that they need to use higher dosages of the stimulatory hormones in order to get sufficient eggs from a collection to then be fertilized. So that's really why this test was developed. It's not the be-all and the end-all. It does not give a woman any indication of quality of her eggs. It just gives an idea of egg reserve and potential responsiveness to IVF processes. So as I said, the antral follicle count test is an ultrasound, a transvaginal ultrasound that is done that actually looks visually at the ovaries and has a look and counts the little antral follicles. It's highly sensitive and highly accurate, and can show how many follicles are ripening and developing in the ovary under the influence of hormones and ovarian reserve. So this is a visual look at antral follicles in the ovaries. So there is many diet and lifestyle factors that can influence positively or negatively a woman's fertility. One of the most significant factors is decisions to delay conception and trying to conceive later in life. You're significantly reducing your risks of conceiving naturally or via assisted reproductive technologies as we get older. So women over the age of 35 are nearly twice as likely to present with unexplained infertility as compared to the younger cohort of women. So obesity is a huge infertility risk factor, and that's one of the very first things that we need to support a woman around to lose weight and come into a healthy BMI, which is really about 22 to 25 on a BMI index for optimal reproductive health. Okay, 22 to 25 is where we shoot for. Don't forget, as women are actively losing weight and burning body fat, we're dumping toxicity back into the bloodstream. So that's the detox phase and the weight management phase, after which then really we need to be doing 4 months of preconception healthcare. So obesity risks hormonal balance, fertility, miscarriage risk, poor pregnancy outcomes, gestational diabetes. If a woman goes into pregnancy obese, then she again puts herself and her baby at risk with gestational hypertension, preeclampsia, liver and cardiac dysfunction, impaired fetal growth and development and well-being, and delivery complications. We know that women with a higher BMI or obesity in pregnancy will usually deliver preterm and via cesarean section because obstetricians won't take the risk. Okay, obesity is a major cause of anovulatory infertility. So things like polycystic ovarian syndrome are highly driven by cardiometabolic disease. And in one study, 80% of obese women, losing just a modest 5% of their body weight, had improved reproductive health and regular ovulations again. So weight loss strategies are critically important, and we've got so many fantastic strategies for detox and weight loss at the same time within the beautiful products that we all love to use in our practice. Okay, however, little improvement in reproductive health and ovulatory frequency was seen in women who lost less than 5%. Visceral obesity caused more conception difficulties, even in ovulating women, okay? So getting to a healthy BMI is so critically important, not only for conceiving, but we've really got to keep forefront in our mind for the health of that child when that child is born and grows to an adult. We know there is very high risks of type 2 diabetes in childhood from babies born of mothers who are obese while the baby is gestating in utero. Such significant statistics. Okay, so women with a BMI greater than 35 need to lose weight prior to conception. And don't forget that weight loss is a time where you're going to dump more toxins into the body. So we need to be actively sort of doing weight loss and detox at the same time. Okay, we know again, as I've already discussed, that obesity in men is associated also with a greater incidence of low sperm count, motility, and concentration, and a very poor DNA status in men. So here's some hard and fast and quite shocking evidence from a clinical trial about the impacts of lifestyle choices on fertility and how much they significantly reduce fertility, particularly exposure to toxic solvents, illicit drugs and caffeine, alcohol, smoking, and of course being overweight. So these are all what we need to be tackling in preconception. It's education, awareness, diet change, lifestyle change strategies. That's what preconception healthcare is all about, and that's what ultimately improves fertility, not only helping couples get pregnant, but have a healthy baby. That's what we need to keep forefront in our mind. By the way, there's an incredible book written by a very well-respected dietitian in the United States. Her name is Lily Nichols, and she wrote a book called Real Foods for Pregnancy and also Real Foods for Gestational Diabetes. Her principles are very well evidence-based and very well researched, and you're going to love this. They're predominantly Western-based Western price-based diet principles. So check out Lily Nichols. I'm such a fan of hers, and I think she does some of the best work internationally in educating around diet for reproductive health. Okay, so let's talk about our core herbs for enhancing female fertility. We have a lot of them, thank goodness. Mother Nature is kind and generous to help the human species continue to survive when it comes to providing plant medicine. So we have chase tree, white peony, shatavari, tribulus, black cohosh, rosemary, and schisandra. These are few of my favourite and most relied upon herbs. So chase tree. Chase tree we want to think about as a wonderful promoter of a healthy luteal phase in women. So once ovulation has occurred, The corpus luteum is produced from the event of ovulation and fuels beautiful progesterone in the luteal phase, which is critical for implantation success and pregnancy success. So chaste tree promotes a beautiful, healthy luteal phase, healthy progesterone production. It normalizes cycle length. It particularly is wonderful for reducing PMS, which is always a sign that progesterone is not well balanced. It supports a healthy period in women. It helps support skin and hormonal health, which in turn, of course, when you've got beautiful progesterone, you optimize the endometrial environment for an optimal implantation and pregnancy success. Low progesterone is still one of the drivers of infertility in a lot of women. So it's critically important that we correct that with chaste tree, essential fatty acids, vitamin B6, and the herb peony is also one that I use for beautiful luteal phase progesterone support. So Vitex agnus castus is a core foundational female herb for optimizing fertility and supporting for implantation success. And its mechanism of action is it nourishes the corpus luteum to allow that corpus luteum to produce good progesterone, whilst also inhibiting excess prolactin. And high prolactin is often driven by stress. Okay, there's randomized, double-blind, placebo-controlled trials with chaste tree for luteal phase defect. There was a daily dose of 20 milligrams given in this particular trial, and the aim of the trial was to prove whether elevated pituitary prolactin had an impact on luteal phase. And blood for hormonal analysis was taken between days 5 to 8 and again at day 20 of the menstrual cycle, so peak luteal phase, after 3 months of therapy. What we found in this trial was that the prolactin was significantly reduced after 3 months of therapy with chaste tree, and the shortened luteal phases were extended and normalized, and there was optimal progesterone synthesis to improve reproductive health and fertility. One of the side benefits seen in this trial was greater conceptions as a result. So chaste tree supports healthy prolactin, it supports healthy progesterone production and balances the luteal phase. Really critical to have a good endometrial lining, a really good luteal phase for implantation success with fertility. Okay, white peony is a beautiful plant that I use absolutely every day in my clinical practice. It is wonderful for, again, promoting beautiful, healthy progesterone, healthy luteal phase. When combined with licorice, from traditional Chinese and Japanese medicine, we know that licorice and peony as a combination is excellent to lower elevated testosterone levels, commonly seen in polycystic ovarian syndrome. It normalizes prolactin levels, promotes healthy estrogen regulation, and promotes a healthy conception. So the licorice peony combination is something that I, again, use every day in my clinical practice. So peony combines really well with chaste tree and licorice to optimize female fertility. Then we have the Ayurvedic wisdom coming from the beautiful Shatavari, or asparagus racemosa. Now, this literally means she who possesses 100 husbands. It is a core female fertility herb from the Ayurvedic system. It's regarded as a beautiful tonic to the female reproductive system, a tonic to the ovaries, fallopian tubes, uterus. It's rejuvenative. It's an adrenal adaptogen, helps mitigate the effects of stress and fatigue. The active constituent in Shatavari is called steroidal saponins, which support a subtle estrogen modulating activity. So whereas, peony, licorice, and chaste tree are more luteal phase support, Shatavari is more of a follicular phase support. So really supporting healthy estrogen and healthy reproductive tissue in order to support a healthy conception and good fertility. So Shatavari promotes general well-being, reduces the impacts of stress on infertility. It promotes estrogen balance. For menopause, it regulates menopausal symptoms. It improves vitality, and it brings moisture and energy to the reproductive organs of women. So it's, again, so traditionally used in Ayurvedic medicine as a number one female fertility tonic. Now, from the Bulgarian research, Tribulus terrastris is equally as important in women's fertility as it is for men's fertility. So Tribulus contains a steroidal saponin known as protodioxin, and that comes from, the very specific plant that research has demonstrated. So you'll often see Tribulus fruit used in many products, and the fruit is not where the furustanol saponins as protodioxins are found. So it's critically important to use the right part of this plant in order to drive its medicinal effects based on the Bulgarian Tribulus research and studies. So the furustanol saponins coming from the leaves, not the berries of this fruit, are where the active constituents are found. Now, these active constituents work at the hypothalamic level, so the master endocrine regulator, to promote better estrogen in women, better testosterone in men, and regulate from that master hypothalamic level. So research shows that it's wonderful to regulate estrogen, testosterone. It improves men's fertility, women's fertility. It really supports and boosts ovulation when taken in that follicular phase. There's PCOS clinical trials that have shown when Tribulus is taken from days 5 through till ovulation, it can shorten the luteal phase in polycystic ovarian syndrome, which is typically very, very long. So really, it's an ovulatory booster. It's such an incredible herb. So it's also a general tonic. It's an adrenal adaptogen. It's an estrogen modulator. It's an androgen modulator, so it can lower elevated testosterone in circumstances like PCOS. It's a restorer of vitality. It's a wonderful adrenal herb. It improves DHEA production from the adrenals, and DHEA is a really important hormone for reproductive health of men and women. It reduces the physical impacts of stress. And as I said, it's a very well-researched and well-loved fertility booster for both men and women. Okay, so its indications is for female infertility. It's best taken in the follicular phase. So from about day 5 of the cycle through till a confirmed ovulation to really boost that ovulation capacity and get a really robust, beautiful, healthy, juicy ovulation happening. It's wonderful to mitigate the effects of stress. In PCOS, it's very beneficial as, again, taken days 5 through till a confirmed ovulation. In PCOS, it's mainly used to reduce elevated testosterone levels. It supports healthy DHEA levels, so it's very good for women over the age of 35 trying to conceive, to improve DNA integrity and improve that hormonal aspect of fertility. When we see an elevated FSH on blood testing, which will tell us that we have low levels of reproductive estradiol, Tribulus is the main herb that I'm going in to prescribe in those circumstances. There's also a little bit of research around its ability to boost growth hormone, which improves DNA health and improves follicular genesis and egg health and egg quality. So in assisted reproductive technologies, they'll often prescribe the drug DHEA and then prescribe the drug growth hormone to improve ovarian health in women. So Tribulus is like the natural version of that. So essentially, it's best taken days 5 through to 14 or a confirmed ovulation for the preconception phase of between sort of 2 to at least 4 to 6 months. And its main aim is to support healthy hormone levels from the adrenal perspective, growth hormone, DHEA, and estradiol. Okay, now we have black cohosh. It's traditionally been used as a female reproductive tonic. It's wonderful for ovulation pain and female infertility. So it's a real ovarian tonic. Studies suggest taking 120 milligrams of black cohosh a day alongside the fertility booster drug Clomid or clomiphene. Increased pregnancy rates in infertile women compared to just using the Clomid alone. So there is research and evidence. If women are taking Clomid as a fertility booster, you can safely use black cohosh alongside it. So black cohosh, think about it as a selective estrogen receptor modulator. So it balances and normalizes estrogen level. It's an ovarian tonic, so boosts health and quality of ovulations. It also is very wonderful to help reduce any ovulation pain or discomfort, especially if women have ovarian cysts that can drive some ovulation pain. Okay, black cohosh is also of benefit for women with polycystic ovarian syndrome due to the fact that it's a selective estrogen regulator in the body. One of the other herbs I love is Schisandra, the 5-flavored berry. Schisandra is a wonderful herb for supporting phase 2 liver detoxification pathways. It's an adrenal adaptogen and reduces the impacts of biological stress. Schisandra is really wonderful as generally a full tonic to support lowering toxicity, lowering stress, by then impacting supporting healthy fertility. So it's a really incredible botanical here, and I use it absolutely without fail for all of my fertility couples, men and women. It improves your antioxidant status. It normalizes liver enzymes. It's wonderful for cardiometabolic complications associated with fertility. And it's particularly important while you're doing that weight loss phase of preconception healthcare to help the body sufficiently detoxify via liver pathways, whilst also mitigating the impacts of cortisol and stress. Likewise, this is why I use a lot of rosemary in my preconception and my detoxification phase of optimizing fertility for couples. Rosemary is an incredible phase 2 liver support. It's an NRF2 primer. It's critically important for microcirculation and DNA protection. So it's a very important part of that sort of weight loss, preconception healthcare detox phase of optimizing fertility in both men and women. So rosemary is a very valuable asset, particularly when combined with Schisandra for preconception healthcare. So in summary, we've talked about our herb Shatavari, peony, and Schisandra. These are wonderful everyday first-line supports for optimizing female hormonal health and therefore optimizing fertility in both your follicular and your luteal phases. These herbs, when combined, encourage healthy menstrual cycles, alleviate period pain and any PMS. They optimize ovarian function, optimize ovulation, support the luteal phase. So it's a wonderful first-line support for all of your female fertility patients. Then we absolutely cannot go without supporting DNA integrity and mitochondrial health with NRF2 priming herbs. Grapeseed, green tea, and turmeric are my favorite. Then we want to upregulate detoxification and support the liver. So rosemary, Schisandra, and milk thistle. We need to reduce the toxic burden to improve oocyte development and improve the genetic health, the DNA health in the ovary. So we need to support that gentle detoxification all the way through the preconception phase. Tribulus is a core support for boosting a healthy ovulation. So think about it as a follicular phase ovarian boost. It supports healthy estradiol, healthy DHEA, healthy growth hormone, and gives those eggs the very best chance of being optimal to promote healthy conception. Tribulus also very much helps to regulate a very long follicular phase, which is very typical to polycystic ovarian syndrome, or can be also very typical to women with low estrogen. So equally as beneficial for both of those clinical circumstances. Then we have black cohosh, again, a beautiful selective estrogen receptor modulator. So this simply means if estrogen's too high, like estrogen dominance, it can help to lower it. If estrogen is low, it helps to balance that estrogen upward, optimizing that follicular phase estrogenic environment to promote a healthy ovulation. So it really supports ovarian health. Think about black cohosh as an ovarian tonic. Well, that comes to the end of the formal part of my presentation. I'd like to gratefully acknowledge Jo Boyd for her contribution to some of the slides in today's presentation. Thank you.